Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, the focus is on identifying the common barriers that members of our community face that prevent them from receiving the necessary health care. Our guests for this episode are two of the social workers with IRMC Physician Services, Rachel Grove and Jonathan Hunte. They will be discussing barriers and challenges that prevent rural healthcare clients from reaching their optimum well-being and goals. Today, we're pleased to have two social workers who work with IRMC Physician Group, Rachel Grove and Jonathan Hunte. Welcome, Rachel and Jonathan.
Hello.
Thank you.
So to get started, would each of you mind just briefly sharing a little bit about your background and what you do and how long you've worked with IRMC Physician Group? Rachel, would you mind starting?
Sure. As you said, my name is Rachel Grove. I am the director of ambulatory social work for the hospital, and I'm also a clinical social worker. I've been with the hospital for 15 years. Prior to this, I worked in community mental health and developmental disabilities. I'm an IUP grad, so I stayed local and really enjoy living in this community and getting to do what we do.
Thank you very much, Rachel. Jonathan, tell us a little bit about yourself.
Well, I am a clinical care coordinator for the Indiana Physician Group. I work right under Rachel. I am also an IUP grad. I actually started IUP in 2014 and I graduated my master's in 2020. I did intern with Indiana Physician Group in spring of 2020, which did cut short due to COVID. I started back here in August of 2021 and I've been here for a year and a half.
Thanks, Jonathan. So just if someone doesn't know what a social worker does in a physician practice setting, could you give us a brief overview of what some of your job duties are?
So I do a number of different things. The main thing that I have been doing is I work with a lot of uninsured and underinsured. I do help with people with finding food resources, transportation resources. That's kind of like a lot of the things that we do at our department is that we help people find resources and we engage with them and we talk to them on what's going on in their lives and we try to help as best as we can with their needs. So we also help people with their drug and alcohol needs and we help people with their mental health needs. If people are looking for it, if they need it, we also help people look for higher level of care such as personal care home or a nursing home.
Wow, that's a lot of different needs that you're helping individuals address. What would you say is the most common need that you're finding yourself needing to help individuals with?
It really all depends. It really does. Like everybody's situation is different. So no matter if I can have three people who have insurance needs, but then they might also have underlying needs. They might have insurance needs, but they also need transportation for one reason or another, or that they might need insurance and all of a sudden we find out that they do have a lot more financial concerns, that they might need some food as well, or need some resources for food. It just really depends on the situation per person.
And if you think of the example that you just gave, Jonathan, someone identifies something as a barrier. It's then you're uncovering everything else that's compounded with the one little thing that someone has started with. And you think about, that's why they're not going to the doctors. How are they getting there? They're worried about the cost behind it. What's going to be the outcome of it? So it does tend to, when you think peel away an onion, as people start to kind of share some of the needs that they have.
And as you describe that, I get the sense that it's not always a very simple one type of need or one issue to address. There's a lot of complexity, a lot of overlapping issues.
Yeah, and it's developing a relationship with our patients. We're a small community. We see people at the grocery store. We may work with them, and it's developing relationships with them to kind of understand, here's what I'm struggling with. Jonathan's identifying the resources that our community does have and how to access them. Good question you had asked in the beginning was, what are our what do people come to us for? I think oftentimes our physicians and our nurse practitioners are coming to us because they don't know what to do. The patient's struggling, your typical interventions aren't working. You prescribe a medication for high blood pressure. Why isn't the high blood pressure going down? Well, food, cost, the economic component behind it, getting it.
So, Rachel, you've had an opportunity to work in this field for several years. I'm just curious, have you seen a change in either the amount of need or the types of needs in our community?
It really is. I'll kind of echo what Jonathan said. It's all over the place. The most prevalent one that we're probably getting referred would fall into the mental health range. But again, that's going to be compounded by how am I going to get there? How am I going to potentially afford co-pays? And where can I go? Everyone's finding themselves, what do we want to call it? I don't necessarily want to say a shortage, but like in a...
kind of have a shortage.
It's a shortage. It's difficulty finding a place to go.
Well, even the example of whenever we went to it's IUP at RMC, whenever we had the guy talk about all the statistics, he said that Indiana County has one of the higher amounts of therapists, but at least from our perspective, we still struggle with finding.
That doesn't mean they're going to take your insurance. That doesn't mean you're going to be able to get there. They're going to have an evening appointment.
Exactly. It's still hard to get people connected sometimes. Even if we do have a higher than average amount of therapists in the area, there's still so much need.
Still a
it just
barrier.
doesn't. Yes.
It's not a one size fits all.
Yes.
I don't know if you're still recording, and maybe this is good conversation. But
Keep going. You're fine.
So going back to the mental health piece, it's really being able to find a place for someone to go for treatment that meets their needs and that their insurance will accept.
I would like to also add that whenever we talk to patients, I think they like the fact that we listen to them. Some people just want to be heard in what's going on in their lives and what their needs are, and they might not get that in a quick visit with their doctor. But that's where we come in, because we get to engage with the patient and we get to talk to them and we get to spend a lot longer with them and really hear them out and what their needs are. And sometimes they just want to talk, and that's really the end of it. If they want us to help them with something, we can help them with that. But there are times where they just want us to hear them out and validate their feelings. Throughout their lives, they may not be feeling validated, and they just need someone who is on an outside perspective who just can hear them out.
Thanks for sharing that. And that's just very interesting to hear how being that person who's willing to listen, to make space, to have time is very important, as well as the resources for individuals. Mm-hmm. So as you identify needs in our communities, I'm hearing mental health is one of the needs that's there. I think earlier we've heard mention of food, heard mention of transportation. How do you go about connecting individuals with resources?
Well, first we do an initial assessment. We talk to them. We ask them a list of questions to see what their need could be. So, for example, let's say if I'm doing an insurance referral and I'm asking them about their income. I'm asking about what are the size of their household. I'm asking them, does their spouse work? Do they work? Do they get disability? Do they just get regular Social Security? I'm asking them all these questions. And then I will just say, okay, I think you might be a good candidate for maybe medical assistance, or maybe medical assistance for workers with disabilities. They might even be able to qualify for the HIP program. And you don't have to repeat your question because I feel like I'm getting lost in the...
So my question was, how do you, once you identify a need, how do you connect people with resources?
Okay. So I can do an application with people online for the medical assistance, for MAUD, for even for the HIP program. And once I do the over the phone with them, I can connect with the caseworker from the Indiana County Assistance Office just to make sure if they need any additional documents, if they need anything signed, is there anything else that the patient has left to do? And I can be that middle person just to make sure the information gets back and forth, because sometimes, and this is part of what we do too. We kind of connect people together, and sometimes like the assistant's office might try to connect with the patient doesn't answer for some reason, or vice versa, and we could come in and say, all right, like, what do you need to do? You need to do this? Okay, let me talk to the caseworker. The caseworker says this, okay, well, let me relay it back. I will make sure that the patient will do this, and we can get that what they need going.
So definitely can hear that you play this really important role as being a bit of a navigator, and sounds like a bit of a translator as well.
Yes, yeah, yes. Because in another example for transportation, like we help people get signed up for, let's say, senior share ride through Indigo. Some of the elderly population might not be able to navigate those phone calls or make those phone calls themselves, and that's where we would come in again, and we would even make those appointments or schedule those appointments with Indigo for them, so then we can make sure that they get to those doctor's appointments, and we can eliminate that barrier of them not having transportation to get their health care. That's one of the ways that we, help with those social determinants of health, because we are involved with these patients, and we're trying to make sure that they are where they're supposed to be.
And it's finding a balance too, because most of our folks have access to phone. And a lot of the stuff can be done by phone. But then the world of technology, now you're using an app, or you're supposed to apply online for this. And most, I don't want to say most, but a lot of our folks don't have internet access, or they're a population that doesn't have a smartphone, or try to fill out an application on your smartphone is challenging sometimes. So those are the things that we're going to step in and do, like Jonathan was saying. And folks that are independent enough that can do it on their own, fantastic. Here's the resource, take it and run kind of thing. But a lot of it is we're kind of that go-between, making the phone calls, scheduling the appointments.
Example, like I actually talked to someone today, a 22-year-old. He was looking to apply for medical assistance, and I left it up to him. I said, I can always apply with you over the phone. I can at least keep track and see if I were to do it with you. But if you want to do it yourself, be my guest. That's up to you. And he did say that he will apply for himself online, but if he needs my help, he'll give me a call. So, leave it up to the patient to let them do what they want to do for themselves, but always be available if they need some extra assistance.
As you think about our community, there's lots of different resources out there, but where would you say are the biggest gaps of where there's not enough help or support in some of these areas?
That's a great question. I think right now we're in a different time than we were pre-pandemic. The shortage of caregivers to work in the home setting with folks. There's a lot of programs out there that can provide in-home care for income-based folks. That's really a gap, because we could have more people staying at home, more people more successful at home, potentially even less hospitalizations, if we had folks in the homes tending to some of the basic needs of an aging population. That would be my pick.
Could you share a few examples of what some of those basic needs might be?
Meals, meal prep, hands-on care, being able to dress yourself.
That's a big one.
We think of, maybe I can't cook the food, but the setup for the food and bringing the food to the table and putting out the things that you just need for that first initial beginning step of a meal is difficult. Most of our folks are using the microwave, not really doing a whole lot of oven and complex type of cooking, which then you could say translates into then what's the nutritional value of the meal that we're having if we're doing it all in a microwave.
That was my next point.
Kind of thing.
Doctors might want you to have a more nutritional diet due to one condition or another, but depending on what they can afford.
High blood pressure, diabetes, I mean, those are the two big ones.
Depending on what they're even capable of doing, they might not be able to meet those needs that the doctor would like them to meet. So then it creates this, tension's not the right word I'm looking for. It creates this disconnect, maybe?
Sure. Why isn't your blood pressure going down? Well, you're eating frozen meals.
Yeah.
Oh, what does that look like when you really look at the nutritional value of it, kind of thing.
Yeah. So, it's kind of hard to navigate, okay, the doctor wants you to do this, but you're only capable of doing this. What can we do to help? And I think that's one of the roads that we try to navigate into how best we can help this patient and find the resources to really get this patient what they need and medically be okay where everyone could hopefully be happy. Doctors happy, patients happy, everyone is getting their needs met. They don't have to really worry about their at-risk needs medically. And I could say that it probably gets a little challenging trying to find someone some meals. Like, we can have them, maybe find some meals through their insurance. We could, direct them to food banks, but it really all depends. And again, depends on the situation.
So one of the things as you describe your role is just, I get the sense of how important that partnership is with the physician. The physician is helping to determine the needs of the patient and what needs to be addressed from a medical standpoint, but you're really working in partnership to make that successful by being a resource to the patient.
Yes. So for Indiana Physician Group, we work with a number of physicians here, and we can go out to different offices to even meet patients. And, we work as closely with the physicians as well as the patients. We are, again, like that person who will, connect physician wants and patient needs and try to navigate what's the best solution. We work hand in hand to come up with a game plan to, again, to help serve the needs of the patient.
If there was one thing that you could change in our community that would make care more accessible and help with needs, what do you think that wish would be for?
Are we allowed to be funny?
Sure.
I was supposed to win the $1 billion Powerball. And I had a lot of great ideas. What would you change?
Right now, because I just see it so much, I feel like we need more therapists, but I don't know if that's just to say that, the need for mental health is just more now than it was before. Maybe we're recognizing what mental health is more than before, and now we're like, oh man, like, okay, now
people are talking about it.
Exactly. More. People are talking about it more, and the statistics are saying that we have more therapists, at least higher than average in this county. But now that we're recognizing more and people are talking about it more, like now we're like, oh man, maybe we don't have as much as we would love to. And I think that if I could change anything, I guess it'd be somehow getting more mental health providers in the area, just so we can be able to get that need met. It just feels like sometimes we're not able to help the patient as much if we were able, because, example, there are patients who might not have the best relationships with other providers and may have to move on to another one, but, we only have so much in the area, and sometimes they might have to outsource to another county, but...
And when that happens, we aren't seeing legislation keep up with how healthcare is changing too. Mm-hmm. So maybe you live in another county and your hospital is here in Indiana. Well, your transportation may not always take you across the county lines for your appointments. So then what do we do?
All these needs are they're intertwined. they get intertwined, and we get one solution but find something else that they might need help with, and it gets tangled together, and we try to make it as smooth as possible.
I would pick taking care back into the community, going back to the house call visits is what I would pick, because I think the barriers we're seeing is people getting these things. Okay, if we have the resources, why don't we start taking the resources to them?
And it's lovely to do so. Especially we do have an elderly population here, and we do live in a rural population. If we were to meet the patient where they're at, just for some acute care, just some kind of checkup, I think it would actually really benefit the community, because we could at least negate some of those barriers that are being seen, that they can't even come to the office in the first place for it.
Well, thank you both for sharing that. Just curious, do you ever encounter patients that are hesitant to work with you and to take advantage of the services?
I think there still very much is a stigma when you hear the word social work, that we're taking children still, and, very much associated with the children and youth realm of things. But social workers do very broad spectrum of things, from medical social work to counseling to the care coordination like Jonathan's describing in a doctor's office, from working out in the community to legislation. Like, it's a span of a career. And now I forgot the question.
You did fine. The question was if you ever have any reluctance to take advantage
Oh,
of
yeah. Okay, so yes, reluctance. So people are skeptical, Jonathan brings up a good point. He's asking some pretty personal questions, like, can you tell me about your income? Who are you? Is this a scam? Like,
get that.
And that's, you want people to be asking those kinds of questions, because we do have referrals for people who are getting scammed, sadly. So a lot of it surrounds, I think, just what's our intent. But I think building the relationship, knowing that we're in your doctor's office helps to alleviate some of that. And then we meet a lot of folks that just aren't ready to change. It's okay. It's okay if you're not ready. But we're still going to work on engaging with you to try to move you through that process of change too.
It makes me think back to last week whenever I was talking to a patient. She called us for some help with caregiving resources. And I've never spoken with this person before, so I was just going to ask her some questions just to give me a better idea of who she is, what her need is. And I'm asking her a couple questions, and she's like, whoa, why are you asking me questions? I called you. I'm supposed to be asking you questions. I'm like, well, I just need
some background.
Yeah.
We need some
I kind of need some more
context.
information and context to really understand what's going on here. And eventually we came to a resolution, but she was like, whoa, like, why are you asking me all this? I'm supposed to be asking you questions because I'm asking you for help. So it can get kind of interesting sometimes.
Well, I'm sure your personalities and building relationships really is an important part of your job.
It's a skill.
To wrap up a little bit today, just curious, what do you enjoy most about your jobs?
Everything.
I think it's nice when you get to see the difference that you make, because this is a smaller community and this is a more rural community. You can see in comparison to like a bigger city, because I worked in a bigger city, you can see the differences and the impact you are making. And because this is it's a community hospital, community setting, we are helping those in the community, and you could see the differences that you are making and the gratitude people have for helping them. I mean, there are people that will just call and say thank you. They will call our office and say thank you to our social workers for helping them with their need.
Or maybe the prior conversation that you just had with them, they were very upset and agitated about the situation that they're in. And then 2 days later, they call back and say, you know what, thank you.
Yeah, they will recognize, like, man, like I was, again, with this same example that I just gave you before, the next day when she was able to get her caregiver back, and she was like, man, I was just yelling at you. I was so angry at you yesterday. And then the next day she's like, oh, but I'm so happy now. She was praising Jesus, hallelujah, all that. And people recognize whenever they were mean and probably not so nice on the phone, but they will, sometimes it's just night and day. But, whenever you do help them and, make your best effort to help them as much as possible. I mean, they see that. They see that you are trying to just, help them with what they're looking for. And when you really listen and you make that effort, like they see it.
Well, that's great. And it's great that they see the difference that you make. And can you describe how patients are referred to work with you for social care services?
Oh, that's a good question. So typically, a patient gets referred to us by their primary care doctor, but that's not only source. Anyone in the community could really make a referral to social work. We work with a lot of the private physicians' offices as well, too. An easy way I like to describe it is anyone that touches the doors of IRMC could be somebody that we work with.
Yeah, we get referrals from our normal IPG providers. We get referrals from the emergency department. We get referrals from the outside practices, like Rachel said. We will have even physicians just come walk in our office and say, hey, have this patient right here, right now. We need some help. And we go over the situation, and then we're like, okay, I think I got my game plan. We're going to go in and we're going to further assess, see if they might say something different towards the social worker actually than what they would say to the doctor. Because I've had that where, I go in and I'm talking to the patient, engaging with them, and I come out, I review all the stuff with the doctor, and I'm like, oh, wow, the patient never mentioned this. I'm like, yeah, it's maybe they're just more comfortable talking with the social worker, or maybe
vice versa.
Yeah. And sometimes, like, maybe I would think that patients sometimes just think, okay, well, this is a doctor. I don't know if I need to tell them all my problems. It's just, I'm here for my physical problems or maybe mental health problems, and that's really it. Like, do I really need to talk to the doctor about my food insecurity? Really? Like, it's, those are those social needs that maybe the social worker can come in and, like, really, ask about.
I think earlier you made the great point that the physician doesn't always have that time to talk about those things, where you can inquire a little bit further.
Yes.
That's the beauty of being right there in an office, or not far away from an office. If we need to run over there because someone's in crisis, head on over and talk with the person in that moment, because I think that's an opportunity where you can often have the most change right there in the moment when someone is focused on it.
Yes, I often joke with one of the physicians who would come in after the patient leaves whenever he has something he wants us to work with the patient with, so he comes in and I'm saying, okay, well, is the patient still here? And he's like, no, and then he started to catch on, and then whenever he comes in now, he starts to and ask for our help, and I was like, well, is the patient here? And he's like, yes, the patient is here, so we can work at that moment right here, right now, instead of waiting to go home for a possible phone call, which the patient may not actually answer.
Or have minutes left on their phone, or have a phone accessible to them.
I think that's a great thought. The right here, right now, being able to provide that service.
Mm-hmm. Absolutely.
You often work with outpatients in your roles. Can you describe how the social services needs of inpatients are addressed?
Yes. So our hospital has a team of social workers and nurse care managers inpatient that work on addressing barriers, needs in the moment during that hospitalization. Oftentimes, if the needs for a patient would continue, that would potentially and could get handed off to us to kind of continue to follow. Their role actually is a little bit different because they have a very short window of being able to work with the patient. So they're going to really look at the most important priorities and what's going to keep them and meet their needs for typically the issues that took them into the hospital.
I want to thank both of you for taking some time to talk a little bit about what your roles are and the impact that it makes. And thank you for everything that you do for our community.
You're welcome.
Thank you.
Social workers are a vital part of the healthcare team in a rural healthcare setting. They work closely with physicians and other clinicians to ensure that patients are able to comply and to be successful in attaining their optimum health. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.